Community Spotlight on Z102.9.
Good morning. It's Community Spotlight on Z102.9. Look at that calendar. We are halfway through the month of November, getting into the holiday season. Really a time when you start to think about yourself and friends and family and giving well wishes and making sure everybody's doing well and getting ready for, oh my goodness, the new year of 2022. We wanted to take a moment to really spotlight health this morning, which is why we bring to our phone Dr. Livermore, the Chief Medical Officer at the Eastern Iowa Health Center on a Sunday morning. Thank you so much for joining me.
Oh, so glad to be here. Thank you for the invitation.
So we had a great opportunity to speak with the health center last month, Dr. Livermore, when it pertained to the diaper drive. But there's so much more that you do there. Let's start with the basic question. What is a community health center?
A community health center or federally qualified health center or community health center, we go by all those various names, are linked as a part of a network of other health centers. And we are 14 strong in the state of Iowa and more than 1,400 in the nation. Our federally qualified health center, along with all the others, have 4 key components to our mission and our vision. We are located in areas of need. We provide comprehensive services. And the neat part about a health center is when you've been to one health center, you've been to one. We all do tailor. Our origin stories come from what our communities need. We are open to everyone, and we have a patient majority governing board. So we have a board of directors, and 51% of those individuals must be our patients. For us specifically, we cover not only Lynn County, but also Benton, Jones, Iowa, and Johnson County.
So within those 4 key components and with such a larger footprint, is it fair to ask maybe a typical profile of a patient? Or I'm sure you work or serve a lot of different people.
We do. And back to my statement about if you've been to one health center, you've been to one health center. There is so much diversity in our patient population that we serve, but the biggest component is we do service regardless of ability to pay. So we have insured patients, both with Medicaid, Medicare, and your private insurances, but we also service those who are not able to pay. And a big piece of our patient population is the enabling services that we provide, those non-clinical pieces, so that we can improve the outcomes and we can address the healthcare needs of all the patients that we serve. We are also one of the main sites for our refugees who are coming to our great state of Iowa so that they can have a health home and access our health care and really be welcome to our community and get those vital services.
It's Community Spotlight on Z102.9. My guest this morning is Dr. Livermore, the Chief Medical Officer for the Eastern Iowa Health Center, who just in the last 2 minutes really impressed me with where you reach and how health centers work. And I was doing some research on your website, Dr. Livermore. I think our listeners would be really surprised by your patient volume just looking back the last couple of years.
As a federally qualified health center, we report those statistics. They're available on the web, so you can see ours as well as the other centers in the state and in the nation. Eastern Iowa did have 1,300 unique individuals and more than 55,000 visits in our areas of family medicine, women's health, behavioral health, and dental service lines.
And as I think about my own health care, I've really had to take more control. What I really am impressed by with Eastern Iowa Health Center, we could get them to a website and just based on things you listed, they can do some of their own research. And hopefully, if this is services for which they qualify, they can make that contact with you and move on to the next step.
We can be located on the web. We have a homepage which outlines not only those services, but how to access us, as well as various languages that the content can be translated into for that important piece. And our general phone number is listed there. When you're accessing and you're needing those entry pieces for primary care, I want to put a plug for our amazing community partners. We have access to specialist care. We have access to imaging services, our wonderful hospital partners when our patients are unfortunate to have health care journeys that require hospitalization. We are connected in our community to a great network of partners and highlighted so importantly in terms of access to healthcare during the pandemic and the addition of telehealth. So even if you can't physically come to our access points, we can connect you through technology so that you can get the care that you need.
It's good to know there are people who have your back. And if you Google Eastern Iowa Health Center, that might be an organization that has our listeners back this morning. The time goes by really, really quickly. I'm going to wish you a very early happy Thanksgiving. And thank you, Dr. Livermore, for joining us this morning for Community Spotlight from the Eastern Iowa Health Center. Have a great Sunday.
Thank you. You too.
Community Spotlight on Z102.9.
Good morning.